Hello, my name's Dr. Abigail and I'd like to take a few minutes of your time today to explore how to get the best out of your therapy sessions, particularly your first session. So I'm going to consider 3 areas: pre-session preparation, the session itself, and after the session. When wanting to get the best out of your therapy session, the first thing to consider is when and where your session will be held. So hopefully therapy is going to become really valuable to you, and you may want to be able to attend regularly with relative ease. So with that in mind, try not to book a session where you're going to be in a rush to get there from school or work, or maybe that it's going to be at a time that's a bit too early in the morning for you or a little bit too late. It's not really the best start if you arrive really flustered and stressed before the session even begins. Or worst case, you could be setting yourself up to fail by making sessions just too difficult to get to. And I guess this is one really big benefit of remote therapy, that it's a lot more convenient for many people because there isn't a commute. So when thinking about pre-session preparation, the second area to consider is admin. Now, often a therapist will send you a therapy agreement or a client registration form, and this needs to be emailed back or filled in on their system before you attend the session. And also have a think about payment. Do you need to take a card with you? Are you paying with bank transfer? Think about how it works. Before the session, have a think about what you're happy to talk about and what you don't want to talk about. While it's great to be honest with your therapist, it's also somebody that you've just met, and it's okay to give yourself a little bit of a chance to warm up to them. But don't lie, so maybe just say, can I talk about that another time? Let the therapist know where your boundaries are, and that's okay. But sometimes it's good for us to think about that before the session. Have a think about what you want to talk about and what you're not quite ready to talk about. And it's okay to let the therapist know that, to say, I'm not quite ready for that yet. Thinking of honesty, then that brings me to in the session experience. You're going to be asked a lot of questions, some of them personal. As I mentioned before, with boundaries, you don't have to answer all of them. But I really would like to encourage you to be honest, particularly about the risk questions. The therapist is only asking this so they can make the most informed decision, so you can have the best care possible. So please be honest about questions on risk, questions on self-harm, suicidality, anything like that, and even questions about the problem. And if you don't know how you feel, just say you don't know. That's okay. The third area to consider is what happens after the session. It can be really helpful to take a pen and paper to write on, or maybe an iPad or a phone, and jot down what you've learned in the session, because these things, they do take a while to sink in. And it might be a revelation that you've had, or a question that you weren't sure about answering, or something that maybe hit home. And if you can write this down, it can be thought about during the week. And people get so much more out of therapy if they take the thinking with them to other days. Another thing on this point is to not necessarily meet anybody straight afterwards. Don't necessarily book a meeting or go straight back to school. Maybe take an hour just to let it sit with you, just to process what's happening, because more work internally can occur if you give it space. Sometimes being too busy can be a little bit of a form of avoidance. It stops us thinking about the painful emotions that come up. Please don't be too quick to be busy, and just give yourself a little bit of processing time, because in an hour, a lot is going to be talked about. Likewise, again, maybe refrain from drinking and sedatives after the session up to 24 hours. I would say, if you can, just sit with the feelings that have come up, even if they've been difficult, and just sit with them, and you might dream about it and you might have more revelations. If this has been helpful today, please subscribe. If you're thinking of therapy, please get in touch. It's really simple. Just go to my website, malvernhillsprivatepractice.co.uk. I lead a team of 12 therapists. If you fill out the self-referral form, we can get back to you and advise on the most helpful therapists that we think for your difficulty, and we'll send you a feedback form with a link to book in with them. Thank you for listening.